Hello everyone. Today I would like to welcome our very talented POS instructor, Dr. Claudia Tossolini, who is also the head of the orthodontic department at the Medan International School of Dentistry in Medan, Indonesia. Welcome, Dr. Claudia.
Thank you so much for having me, Vera.
It's always so nice to see you.
Okay, thank you.
So, Dr. Claudia, can you please tell us a little bit about your orthodontic background?
After my graduation from dental school at the University of Rosario in Argentina, I wanted to start training in orthodontics as soon as I could, find the right program and get admission. So I did my research, and I was recommended a 3-year training in Buenos Aires, and at the Argentinian Dental Association. The University of Buenos Aires also had, of course, an ortho department and an ortho training, but I didn't have a good reputation. So I selected this program with the Argentinian Dental Association. Why? Well, the director of the program was an orthodontist who trained in Michigan, in Ann Arbor, with James McNamara, who is one of the greatest, he's known as one of the greatest orthodontists of all time. So then he returned to Buenos Aires and opened this 3-year program that, wow, it was great. It felt like we were training in Ann Arbor. And so it worked very well for me. I did not get admission the first year because they have many applicants, so I have to wait. But I decided to stay in Buenos Aires waiting for my turn. And I remember I became very interested in mixed dentition, and attended so many lectures on preventative orthodontics, interceptive orthodontics, early treatment, as much as I could, because I was very young and eager, and then I started the 3-year program where, of course, we treated patients, many patients, and had a lecture in the morning, and then we went to the clinic and we had all these, different patients, new patients that I started, patients that I inherited from, previous years, and we were 9 in the clinic, 9 students. 3 students per instructor. That's the way it functioned. And as I said, it was great. I wanted to pursue, my ortho career, and that's the reason why when I finished the 3-year training, I moved to LA. And when I got to LA, during the program also, because many times people ask me, oh, how you did this? I tried to use the time the best I could. So whenever I have time, I sign up for some other courses over the weekend. And that's the way I ended up, training on removable appliances with the Orthopedic Dental Society, and then the bioprogressive technique of rickets became so famous at that time. So I also trained on rickets. I ended up training with a woman orthodontist who trained with rickets actually here in LA. And then I did as much as I could. When I finished the 3 years, I moved to LA, and I liked over here. It wasn't probably in my plans that I was going to stay in the US, but I decided to get the license right away, my dental license, and it took me 15 months to pass all those exams. And then I applied to the ortho school here in the States, and that's where I found some obstacles. Yes. And they wanted me to go back to the general dentistry residency and then apply to the ortho school. And, and I said, oh, it doesn't sound right. I already have a dental license to practice, and I also finished the 3-year program under basically McNamara school. So that's when I started looking for a program that was teaching to general dentists, and I went here and there, and one day, lucky, me, that I came to Dr. Magann's lecture when he was the only instructor at that time. I think it was in 1992. And I said, wow, I like this. It's very similar to what, the McNamara school, and and then, I decided to, and I'm here since then, So you know.
Well, we feel very lucky
Yeah,
that
and
you found us.
I could continue talking about my background, but that's kind of very briefly what happened. And actually, this is interesting. When I decided that I was not going to pursue the ortho program in the States because I didn't want to return to the general dentistry, I went back to the country and finished with the requirements, you know. And because, of course, my program was eligible for board certification, right? And then I was granted a degree as a specialist, you know, by the University of Maimonides in Buenos Aires.
Dr. Claudia, since you have such an extensive background in ortho and you have attended different programs, what are the main benefits that you would say the POS students get compared to other programs?
Well, the POS program, the content of the program and the study material, I would say, is extremely good for a program who, you know, is teaching to general dentists. I don't think you can find better. It's challenging, but, you know, they can do it. If they push themselves, you know, getting the patients, and that's the reason we advise a student to start as many cases as possible. You know, at least 30 cases is my recommendation. I know some students do it. I've known doctors who started even more than that, but that's what is going to get you some confidence, you know, and then you can relax. And besides that, because you are not training in the clinic with an instructor, I strongly recommend the case diagnosis support, especially the mentoring. You know, I tell doctors it's really probably the best investment that you have ever made, you know what I mean? Oh, yeah, you know, and because it's difficult to start 30 cases, 40 cases, and, you know, when you have not done this and you don't know what you are doing in the beginning. So it's very, very important that you know that you have the support. And I think the POS support is just, it's also very, very good, and, you know, and people should take advantage of that.
So, Dr. Claudia, I can see and we know how passionate you are about orthodontics, but what interested you to treat mostly ortho patients?
Oh, let me tell you exactly the way it was, because, yeah, this is very, very, you know, interesting. You know, they don't teach ortho in dental school, right? We had like a couple lectures, but that's about it. So one day, they took us, when I was in the last year of my dental education, to the orthodontic clinic where the students in the specialty were treating patients. And I don't know, probably it was just coincidence, the day where they scheduled this kind of patients, I don't know, but I remember we stopped by a chair and they said, oh, this is a post-op from a orthodontic surgery. She had maxillary surgery, like maxillary impactions, something like that. So I started working in the clinic and I see all these patients with visible problems, right? Like AP problems, vertical problems, asymmetry, things like that. And I say, wow. This is so interesting, you know, and it's very different than what I've been doing so far, like, you know, fillings, you know, cleanings and this and that, crowns, and I thought that that's what I wanted to do, you know, and I said one day, you know, I can, you know, have the skills to help these people and work on this kind of patients. I think is really more interesting than the rest of dentistry. That's the way I felt, and of course, we are talking back in the 80s, you know, and these days we do some other, you know, things in dentistry, you know, with the implants and all that. But honestly, the field of orthodontics is just, it's different.
It's probably very rewarding.
Yeah, very rewarding, and so yeah, and I never changed my mind. You know, a few months later, I graduated, right, and a few months later, I was already in Buenos Aires because I was, you know, not in, you know, it was a different city where I graduated, and the rest is history.
Dr. Claudia, what tips do you have for someone who would like to be successful in ortho?
Well, first I have to say the training. you need the skills. They need the skills. And we don't have to forget about the standard of care law. We have to do it at the level of the specialist. And so it's very important to, that's why I kind of went over when I selected the program, because I think getting into the right training program from the beginning is very important, because that's what's going to shape up your career, your future. And if you are talking about, I want to build up a successful ortho practice, and you are a general dentist, it will start by getting into the right program. And after that, of course, they need to know their goals, like we said before, how they are going to do it, still doing all this general dentistry, or maybe now I want to do only ortho. And so it's two things, select the right program, push themselves in the beginning, because they are going to have to do it, the clinical part in their practices, and then know exactly what they want. It's very important to know exactly what they want, and how they are going to incorporate, and how much ortho they want to do, and comparing to the general dentistry and all that. And it's a long subject, but that's basically what they have to do. But select the right program.